Hello, friends. Imagine a condition of hypotensive shock. The patient is in hypotension, and so much so that the blood pressure has dropped that circulation in a particular limb will stop completely. Is that possible? Yes, it can happen. Or imagine a neurosurgery or surgery going on, and the blood pressure drops suddenly, and blood flow to some region in the brain will stop completely, and the possibility of ischemic stroke arises. Well, these are certain conditions that may emerge in certain clinical settings, and therefore we must understand the concept of critical closing pressure. In the recently concluded NEET super specialty entrance exam, one MCQ was asked related to this particular concept. So let's see what the concept is. I'm sure this discussion will be helpful for the students of post-graduation in medicine or physiology or PG entrance exams and super specialty entrance exams. And of course, the students of first MBBS and final MBBS. Okay, so basically we are talking about the pressure in the circulation. And critical pressure means below that level of the blood pressure, there's going to be the problem. What problem? Well, the vessels will close down and the blood flow will stop completely. So that's the concept of critical closing pressure. Now, before we proceed further, let's just quickly understand the concept of blood pressure. It's not a very simple concept. The blood pressure in the circulation has got three dimensions or three facets. One, the hydrostatic factor. Let's say at the level of heart, there is a certain pressure. Then below the level of heart, the pressure is more, and that's because of the gravitational factor or hydrostatic factor. Then the other dimension, second dimension for the blood pressure is delta P, P1 minus P2. That is, the blood is being driven from high pressure to low pressure, and the circulation is going on because of this delta P in the circulatory tree. And the third dimension is transmural pressure, pressure across the wall of the vessel. So these three dimensions are there for the blood pressure. Out of these, the second and the third one will be of interest for us, the delta P and the transmural pressure. So let's see what this concept is. Now here, let's start with the delta P, P1 minus P2, and how the blood goes from high to low pressure. That's one dimension of the blood pressure. Look, left ventricular pressure, peak systolic pressure 120 to 130 mm of Hg. So similar pressure in the aorta, about 120. Then mean pressure in the arteries is 100 mm of Hg. Then at the start of the arterioles, the pressure is 80 mm of Hg. Then by the end of the arteriole and start of the capillary, that is when it is entering the tissues, the pressure is 30 mm of Hg. By the end of the capillary, where the tissue ends and veins begin, the pressure is 10 mm of Hg. And from there to the right side of the heart, the pressure is 0 to 2 mm of Hg. Now, you can see here that there is a certain delta P. When the pressure, mean pressure in the artery is 100 mm of Hg, the pressure in the capillaries is 15 to 20 mm of Hg. The average pressure in the capillaries is 15 to 20 mm of Hg. And by the end of the capillary also, the pressure is 10 mm of Hg. Why this pressure is required? This pressure is required for a smooth flow of blood through the tissues. Look, capillaries are present in the tissues, and tissues have certain pressure. Tissues have a certain pressure of their own, and it is about 6 mm of Hg, and this 6 mm of Hg is kind of compressing the capillaries. In addition to that, there is a concept of active wall tension. That is, the blood vessels are lined with smooth muscle, and this smooth muscle, whenever it contracts, it creates a certain wall tension. So when the blood is flowing through the vessels, it encounters these two resisting forces: active wall tension, against which the blood has to go through the vessel, and the tissue pressure, which is compressing the vessels. And therefore you can see that by the end of the capillary also, pressure is 10 mm of Hg by the end of the capillary. 10 means much more than the 6 mm of Hg of tissue pressure, and therefore the blood flow is possible in the capillaries. The blood flows smoothly through the capillaries and then enters the veins. That is how the smooth circulation occurs throughout the circulatory system. And the compressing factors or the resisting factors for the blood flow are the active wall tension, as I mentioned, and the tissue pressure. Now consider this, that if the arterial pressure begins to drop, like as I said, hypotensive shock, and arterial pressure drops below 20 mm of Hg, what is likely to happen? In that case, this delta P will be dissipated greatly, P1 minus P2. Arterial pressure, normally mean arterial pressure is 100 mm of Hg. That is when pressure in the capillaries average, on an average 15 to 20 mm of Hg, and that is the pressure is driving the blood through the tissues, because tissue pressure is 6 mm of Hg. So inside the capillary the pressure has to be greater than 6, of course. So now if the arterial pressure drops to a certain level, it goes below that level, let's say 20 mm of Hg, capillary pressure will then be less, of course. It will fall below 6 mm of Hg, capillary pressure. Average pressure in the capillary is 15 to 20 mm of Hg. Now it begins to drop because arterial pressure itself has decreased and pressure gradient is getting dissipated. So capillary pressure falling below 6 mm of Hg means what? Means now tissues will compress the capillaries completely. The tissue pressure is 6. So if the capillary pressure becomes less than 6, there will be compression of the vessels, these capillaries. Blood flow will stop and the capillaries will collapse. So that's called as critical closing pressure. The pressure at which the flow ceases is called the critical closing pressure. A critical pressure below which the blood flow will stop, the pressure gradient has been dissipated, blood flow will stop and the vessels will close down. That's why it's called closing pressure. That's the concept of critical closing pressure. And what you need to understand here is why it is happening, because there are two resisting forces for the blood flow, and against those resisting forces the blood has to flow. The vessels have to remain open and the blood has to go through them. That is the concept of critical closing pressure in any tissue. Let's go and watch the further details. Let's go into the details and understand this further. Let's understand the pressure flow relationship. Here is a graph of pressure flow relationship. Horizontal axis has pressure, vertical axis has flow through the vessels. A linear relationship, here it's a straight line. This is flow in a narrow rigid tube. Straight, narrow, rigid tube. As the pressure increases in the tube, the flow will increase linearly. And if the pressure decreases, let's start from the top end. If the pressure decreases, the flow will also decrease. So linear relation, but that's not the case in the blood vessels. Blood vessels are not narrow rigid tubes. They are flexible, elastic, flexible tubes. So in the case of blood vessels, the pressure flow relationship normally is like this. And let's see from the top end how the relationship is changing. Let's say if the pressure is 100 mm of Hg, we are starting from the top end and we will move like this. So this curve is for the blood vessels in our body. If the pressure is 100, yes, the flow is very good. Now the pressure drops, let's say 80, let's say here it's 40, and finally pressure 20 or even less. So you can see here, as the pressure is decreasing, the flow is becoming less and less. So pressure of 20 mm of Hg, flow is virtually zero. This point, flow is zero. Now this is the pressure flow relation in a normal blood vessel. You can see the third curve. Shift of the curve has happened here in certain conditions like sympathetic stimulation or increased vasomotor tone. If there is increased sympathetic stimulation, it is going to cause vasoconstriction throughout the body. The vascular tone will increase. Now this is important in the conditions of hypotensive shock. What happens in the hypotensive shock is that there is massive vasoconstriction. It is an attempt to increase the blood pressure, and therefore vasoconstrictor area discharges, sympathetic discharge increases, and there is massive vasoconstriction throughout the body. Compensatory mechanism. Now this is an attempt to increase the arterial blood pressure. So what happens is the active wall tension increases. As we saw, there is something called as active wall tension, and it's a force which is going to prevent the blood flow. The blood, while flowing, it has to overcome this active wall tension. Let me also add here, this active wall tension is because of the vascular smooth muscle cells. The vascular smooth muscle cells are contracting and creating that active wall tension, and it is going inward, and the blood has to overcome this active wall tension and keep flowing through the vessels. Now imagine here that because of that massive vasoconstriction, massive sympathetic discharge, active wall tension has increased. You know what is the result? The result is critical closing pressure rises and the graph is shifted to the right. You can see here that the critical closing pressure for a normal vessel, it was here, this pressure on the horizontal axis. Watch on the horizontal axis, critical closing pressure was 20, means at 20 mm of Hg, the flow was 0. And now with sympathetic tone increased and vasoconstriction throughout the body, critical closing pressure has shifted to 40 mm of Hg. Means critical closing pressure has increased. Do you understand the meaning of this? You know, normally in a normal vessel, normal circulation, even at 20 mm of Hg, there was some flow possible at 20-22 mm of Hg. And if the pressure goes below 20, then the blood flow stops and vessels close down, and it's called as critical closing pressure. But in the condition of hypotensive shock, or when there is increased vasomotor tone and massive vasoconstriction, the critical closing pressure has shifted. This is the curve that you can see, shift of the curve with increased sympathetic discharge. So this is the point, pressure 40 mm of Hg, flow is 0. You can see here, that means critical closing pressure has increased. Means what? The condition has become worse. Previously, at 22 mm of Hg, also the blood flow was little possible, and pressure going below 20, the blood flow will stop. Now, critical closing pressure is 40 mm of Hg, means if the pressure, arterial blood pressure falls below 40 mm of Hg, the blood vessels will close down and the blood flow will stop completely. That is the meaning of critical closing pressure shifting or increasing. That means the condition of the patient, hypotensive shock patient, is likely to become worse. So that's the critical closing pressure. Blood flow can stop completely in a limb. Particularly, I am talking about the limb because limb has got muscle tissue, and therefore that tissue compression is much more in the limbs. So blood flow can stop completely in a limb, despite the fact that there is still some small difference between main artery of the limb and the vein. See, we are talking about the delta P, P1 minus P2. So the pressure gradient between artery and a vein is sufficient to drive the blood flow, isn't it? The blood will flow from artery to vein because of the high to low pressure, the pressure gradient. Now in this case, what is happening is, although there is this pressure gradient still present in a condition of hypotensive shock, this pressure gradient is still there between artery and vein, but the blood flow has stopped. Blood flow in a particular limb has stopped completely. That pressure gradient is worthless. It's not able to drive the blood flow. And particularly in the limbs, this may be observed. So please understand, this is possible in the conditions of hypotensive shock, and they have to be kept, this thing has to be kept in mind while monitoring the CVP or monitoring the arterial blood pressure. These things have to be kept in mind. Now, let's see another significant condition where this has to be kept in mind, and that is in the cerebral circulation. Yes, in the neurosurgery or neurology or cerebral circulation physiology, this factor is very important. Concept of critical closing pressure is important in cerebral circulation. Why? Specific arterial blood pressure at which the cerebral blood flow stops because the blood vessels collapse. That's the critical closing pressure for cerebral circulation. Now, it stops because of the external forces. The blood vessels are completely compressed inside the cranial vault. In the cerebral vessels, the vessels will be completely compressed and the blood flow will stop completely because of the external forces. So what are those external forces? One is active wall tension, which is there everywhere. But the additional factor is intracranial tension. You can see a simplified diagram here. There is an artery, cerebral artery, and it has active wall tension. So the blood flowing through the artery has to overcome that active wall tension. Plus, there is the CSF pressure or intracranial tension. This is surrounding the vessels. You know, CSF is surrounding the vessels. It is on the outside of the vessels. So it's a compressing factor. It is going to compress the blood vessels. And therefore, the blood has to have some force or pressure to overcome the intracranial tension. Normally in the range of 10 mm of Hg in the lying down posture. So this pressure and active wall tension, these two factors have to be overcome by the blood to continue to flow. Therefore, critical closing pressure, as I mentioned already, is equal to intracranial tension plus active wall tension, vessel wall tension. It takes into account these two factors. Imagine that arterial blood pressure is in the range of, let's say, 100 mm of Hg, and it provides a certain cushion, the difference between arterial blood pressure and the critical closing pressure. Let's say critical closing pressure is 20 mm of Hg and arterial BP is 100 mm of Hg. There is a lot of cushion. Even if the arterial BP falls and from 100 it becomes 80 or 70 or even 60 for that matter, still the blood can continue to flow. There is a cushion. The blood flow will not stop completely and the vessels will not completely close down. But if the arterial pressure decreases, this collapsing margin will also decrease. The margin will go on decreasing and it will pose a risk of cerebral ischemia. If the blood pressure goes below a certain level, then it will be unable to overcome the intracranial tension and active wall tension. CSF pressure and active wall tension is there, it's compressing the vessels. So if the arterial BP falls and goes below a certain level, that means cerebral artery pressure also will drop and cerebral capillary pressure will also drop, so much so that those vessels will be completely collapsed and the blood flow will stop, and a real danger of risk of cerebral ischemia. So yes, in the neurosurgery or in the considerations of neurophysiology, we must understand the concept of critical closing pressure. It indicates value of arterial BP or mean arterial pressure at which the cerebral blood flow approaches zero. Cerebral blood flow approaches almost zero, and that means it will pose a risk of cerebral ischemia. So that's the concept of critical closing pressure. And in a nutshell, in a summary, I would say that when the arterial BP is on an average 100 mm of Hg, there is a certain pressure in the arterioles and capillaries, and that will drive the circulation through the tissues. Because there is certain tissue pressure, that tissue pressure has to overcome. In the case of the brain, that pressure which is from the outside, it is not 6 mm of Hg, but it is slightly higher, as we saw the intracranial tension, CSF pressure. And therefore, if the arterial BP decreases and goes below a certain level, which we are calling as critical closing pressure, in that case, the capillaries will close down, the blood flow will stop completely, the vessels will collapse. So that was the concept of critical closing pressure, and I'm thankful to Dr. Anmol Bhambani that he allowed me this, he gave me this opportunity to discuss this concept with you all. Thank you.